I know when to go out, know when to stay in.
A little on Carers UK. So Carers UK was started by a remarkable woman called Mary Webster in 1965. Mary was looking after her two elderly parents and really struggling and thinking, there must be other people out there who are going through similar things to me. And Mary wrote a letter to the Times, and of course that was way before email, and she put her address at the bottom of the letter and got something like 3,000 letters coming back saying, yes, I'm going through this. And at that time it was pretty much all women, and in its early years Carers UK was an organisation for women carers. Now it is for all carers, and we know that I think something like 35% of carers are men. And we have over 30,000 members, over 500 volunteers, over 300 affiliate organisations, and 150 employers for carers organisations. These are employers who recognise the carers within their workforce and want to put in place the support and policies to support those carers who work for them. And our vision is a society that respects, values and supports carers. And if I was stood in front of you in an audience, I usually say, where do you think we are as a society on a scale of 1 to 10 in respecting, valuing and supporting carers? Because it does feel that is an achievable vision. We should be able to do that. But, when you ask carers, most people don't give it much more than a 5. Sometimes it's a 3. I think the highest I've had is a 7. So we've a long way to go still, but it does feel that's achievable. And we know that I've been at Carers UK for 8.5 years now, and it does feel things have changed. There is more awareness of carers now, I think, within health and social care plans and strategies. That when I first started, our volunteers were having to stand up and say, remember the carers, there's no mention of carers in here, whereas there is now. And I think there's much more recognition of carers, even though, as I'm sure some of you would say, that the support for carers and the level of benefits is, we've a long way to go still. In terms of what we do, we provide information, advice and support. So we have lots of information on our website, which is carersuk.org. We have a helpline where you can phone up or email to get advice on your specific situation. And we have lots of printed resources, leaflets as well, for you as well. We also do a lot of campaigning and research to bring about change for carers. So the research I just mentioned that we've launched today, and we also did some research in March into the impact of the coronavirus on carers, and produced a report in April called Caring Behind Closed Doors. And that was where we found out that carers are spending a significantly more time in their caring roles than they were before the coronavirus crisis. We innovate as well, so we provide support to carers through, for example, we have a Jointly app that you can download to put on your mobile phone, and that connects you with other people, say within your family and friends and neighbours, who might be all playing a role in looking after the person you look after. So everyone within that circle then would be aware of when someone's hospital appointments are, what medication they need to take, and how often. So for example, if you were ill or got taken to hospital, the other people within that network will be able to step in and help you out. And then we also have an online community called the Forum as well, where you can connect with other carers who could be living anywhere in the UK, and but will understand what you're going through. They're all carers or former carers, and are there to kind of provide that emotional support and practical tips as well on your caring.